Good afternoon, everyone. Welcome to the September 10th Community Development Committee meeting. I'd like to call this meeting to order. Kelly, have you had an opportunity to take attendance?
Yes, sir. I have.
And we have enough people?
We do, just enough.
Perfect. Thank you.
You're welcome.
Can I have a motion to approve the agenda?
So moved.
Seconder?
I'll second.
All those in favor?
Aye.
Opposed? Motion carried. Any conflict of interest disclosure? None. Moving on. The Capital Region Resiliency Report. Carrie Bedford.
Thank you. So again, thanks for welcoming me today to talk about regional resiliency. I get quite excited over this stuff, so please slow me down, ask questions, because I can get on a good soapbox. So you'll see in the package, I've provided a few slides. But before I begin, I wanted to open up the table, if I could, just to ask what you're hearing about Capital Regional Resiliency Network in your own communities. And it doesn't have to be good, it could be the bad, the ugly, or nothing at all. Anybody hearing anything?
Nothing at all.
Nothing at all.
Nothing.
Sometimes that is good news.
Zero.
Zero, okay. And I don't know if Cheryl is sometimes a member on our committee and her other role. If she's there or not.
Yeah, I'm here, Carrie. I would say the most part, nothing at all, aside from our partners that we have projects ongoing with who are aware of the resiliency network, but otherwise not a lot of talk.
Okay, that's good feedback. So thank you. Because I think from my end of things, it feels like things are gearing up. I've had an inbox full of folks that I would love to welcome to the table. They're just coming out of the woodwork right now, which is really great to see. For context, for those that haven't heard about what the initiative or the work that we're doing, this was founded by Department of Justice and Public Safety, and it focuses on some of the learnings from the COVID-19 pandemic, our ice storms, anytime there's been a bad day. We've learned a couple of things about how can we better prepare for future disaster and build more resilient communities. So some of those learnings have been that our communities are unprepared. Our collaboration is limited, and that a lot of those pre-existing social issues are already exacerbated when a bad day hits. So seniors are isolated even more, food insecurity is still a concern, transportation barriers still exist. And that a lot of our vulnerabilities aren't well understood. And so they might be understood by certain stakeholders, but different lens to help expand that knowledge would be beneficial as well. Some of the other learnings is that we know that resilient communities manage these big problems better. And so a one size fits all approach doesn't necessarily work. We're all unique in each of our communities. We also see that government is not always a necessarily trusted partner. And so how do we bridge that gap between building trust amongst community, citizen level, and government? Some of the funding programs don't necessarily match what those local needs are. And we need to have that integrated and coordinated provincial approach at a provincial level, but also at a community level as well. So you'll see I've just done a little bit of a timeline of what CCR, so that stands for Community Capacity and Resiliency, what our success measures have been since starting. So you'll see, it's not on there, but 2020 was a big year for many in COVID land. That the project was already underway, and it wasn't until 2021 where our government decided that this needed to be a branch. The work that we were doing was important, and so they created the branch in 2021. We have 12 coordinators across the province, all lined up with the Regional Service Commission boundaries. And we have 3 provincial staff, so manager, director, and a project consultant that helps the 12 coordinators do the work that they do. In 2022, we heard through the integration of the local governance reform, so we started to build some of those partnerships in alignment with the LG reform. To date in 2022, we started with 101 different activities funded through our department, funds over $500,000. And just over that in terms of in-kind or partner financial support. And if you go over through the years, you see that just continue to grow. So 2023, we had more of that coordinated provincial supports, customized plans in each region. Each region was able to leverage the full $50,000 every year for some of their funding. Again, that partner financial and in-kind support is growing. And to date, 2024, we have 511 regional partners across the province. We have 12 different regional resiliency profiles that we just launched this year. And we're working towards regional resiliency action plans in over 127 activities across the province. Any questions so far? The next slide is just a bit of our JPS organizational structure. So where do we fit in the scheme of things? So you'll see that we fall under the Division of Securities and Emergencies. And to our sister branch, we're sister branches to NVEMO. And so again, we see alignment with the regional service commissions, but we also see alignment with what that means with NVEMO. So yesterday, in fact, I was at a full day session with our RAMCs to see how we can better inform that response and preparedness plans in their emergency mitigation. And so how do we work better collectively at that level, but also at the regional base level as well. So how did we get so far? So our structure is on the next slide. So I referenced the 12 regional steering committees. So we like to refer to ours as our network. We really see the value of the people we're bringing to the table. So I mentioned earlier the in-kind support. That's really what we're trying to build is that value of the connection. We have 12 coordinators. We report to a core team under Justice and Public Safety. And the fun part about this is we see the provincial alignment happening at the Assistant Deputy Minister Working Group, where they have an interdepartment alignment network. So all of our work is funneled through to that channel. And likewise, we've built a communication line to help share what's happening, boots on the ground and at the provincial table. So you'll see my picture of the sandbox. I like to say that's really the wealth of what we're bringing. I have one sandbox with $50,000 and we all have different gifts and tools to come together and create a sandbox, some sort of feature that we can work on together. So at that sandbox, we have many different representatives, local government, provincial, federal government, many educational institutions, public-private partnerships, NGOs, businesses, Indigenous representation, and lived experience. And so every year, this is the time of year we start to begin our planning process. We put together a regional resiliency action plan. So we want to look at a long-term plan, how we can all work together across all of those different sectors with all of our different tools and skill sets to really create that big sandcastle, so to speak. What is that big impact that we're able to make all together? Any questions so far?
When I was reading this through, I noticed regional is used a lot.
Yes.
Does regional always mean the same region, the same area?
Yeah,
And that's
absolutely.
the big
That's all of us.
capital region.
Capital region, exactly. Yeah. And so a lot of them we see, it is kind of a tongue twister every now and then, regional resiliency for Kent, regional resiliency for, and we're recognized as regional resiliency coordinators. So it is encompassing all of the boundaries of Regional Service Commission 11.
So capital region has one coordinator?
Yep, just me.
That's you.
Mhm. And I will reference too, half of our team are part-time. So I do work full-time for another employer for the Anglophone West School District. The other half of ours are Vitalité community developers, mostly in our Francophone districts. So they work as community developers with Vitalité and do part-time work with regional resiliency as well. So you'll see many other coordinators, mostly in the Anglophone regions. We have some that work for multicultural associations, some that work for their own business, some that are doing different roles. So it's kind of in addition to.
So the school board, Anglophone West, allows time for you to spend on this? Because I can't imagine it's a half an hour every second week.
It's in addition to, so I do 5 10-hour days. I signed up for it.
Okay? That's
Yeah.
good.
Yeah. There's a lot of overlap though, and that's, I think, one of the perks is that we're working with municipalities at the school district level. We're working with municipalities here at the resiliency table too. So there's ways that we can kind of find ways to naturally connect on certain topics as well. Yeah. The next slide is the terms of reference. So that's the magic of, you know, building the plane as you fly it, so to speak. We have new partners coming all the time, and so we needed a tool to help guide that work so people understood what we were doing, but also to keep us on track for what our values and core statements were. So you'll see this is just an overview of what that looks like. Our community or our committee composition and function. So what the role of our members, what they do, how we, you know, it's basically an open table. Some of the responsibilities, we've, in alignment with Regional Service Commission, have created a host organization partnership. And so every year JPS will release our $50,000 in partnership with Regional Service Commission to be the host of our funds. So they are referenced as our host organization. Our regional team will be many, like Lise and Suzanne, many of those that are doing community development work in the region come together informally to help kind of see how we could build on certain projects instead of working in silos. How can we collaborate? Activity leads, we'll go over a couple of projects that have happened over the last couple of years, but essentially these are often co-leads. So 2 people that will lead a project that's been funded, and their responsibilities are to put the activities forward, report on any of the funding, and then of course complete the activity overview at the end to see how we can measure that impact. And then a network member is simply that value that our committee has. We have a number of network members that come just to help to share, connect, and inform. Some that help to roll up their sleeves and dig into some committee work, and some that are that key communicator piece. So some of our processes that we follow. Every year, I mentioned our regional resiliency action plan. There's typically 5 steps. So from April until June, we're looking at the implementation of our current action plan year. So you'll see some of that work being done. Now, as we enter July to September, we are looking ahead to the following year. So where are we at with the projects we set out to do the previous year? Do we want to keep working on those? Do we need to adjust our sails? And then look at what our projects would look like for the upcoming year. We would submit the overview for the following project year in October. And then January, the new funds are released and the project work begins again. And so when we're going through that process, we're always looking at current data that can help to inform some of those projects ideas as well. A lot of that coming from NB Health Council, Community Health Needs Assessment, and of course the people around the table that are boots on the ground. And so some of our vision, I should say, is that we want to really be that incubator for those scalable ideas. So if we can make it work for one area, how can we modify, adapt, share, and bring that idea across the region, essentially, if that's of interest. I'll skip down to some of our value statements, and I'll point out adopt asset-based community development. So recognizing the power and strength through partnerships and collaboration. And so this is kind of those terms folks in community development use quite a bit. ABCD, they're asset-based community development. So I wanted to just dive into that a little bit further. And that's essentially how we've structured even the starting point for resiliency. I included in the package a toolkit from Tamarack Institute. And it's just a simple overview of what is it. And it's, in summary, really looking at taking a strength-based approach. So we're not looking at the deficits, we're looking at who's around the table that can help and what gift do they have to bring that we can leverage. Okay, Kelly. So what is the gift? Instead of saying, you know, this is a gap, this isn't good, you're bringing that sense of hope, that empowerment at a grassroots level that we can all work together and collectively build an impact. Any questions over asset-based community development or anything so far?
So how small a unit are we looking at this asset, these assets? That are community based, is that like on a municipal level?
It's actually at an individual level. So when we first started, and it can scale up, that's the beauty of it, I will say. When we first started and I said, hey, Capital Region, I'm the coordinator, I'm looking for people to come and join our meetings. We're working on some key priorities, so I want your input. Suzanne was at the table when we first started and she brings a lot of gifts, personal and professional level, for example. So she was able to bring connections, she was able to bring some funding opportunities, the context of things that we've done in the past. Another example is that we all wear many different hats as an individual, whether it be personal or professional. So, you know, I'm an avid pickleballer, so I could bring my connections from pickleball to that meeting to say, you know what, so-and-so I play with as a retired teacher, I should ask them about this program. So that strength is really in those connections that we're able to foster. Those that show up at the table and get to know each other and see what we have to offer to the collective table. But in saying that, those connections build on each other, right? So, you know, being in Fredericton or being in Arcadia, for example, you know, I play pickleball at the school is looking for support for their playground infrastructure. And so how do we help to build that asset together? So you're identifying those needs that can help to bring regional assets to the table as well. So it seems quite, I don't know the word, like simple in a sense, that it's almost like a good old bartering, right? Like I have something that you need and you have something that I need, and how can we come to the table and say, let's do it together. And I think we do this, but we don't recognize that this is the practice that we're following. So I wanted to dive in a little bit further into what does that ABCD really do mean.
Can I?
Please.
I probably have too many questions.
No, it's okay.
Do you see some of these needs involving the requirement of money, and then you go to your local municipality for the money?
Yeah, some might have money themselves, right? That's been the beauty of the network, is that they might have money, they just need volunteers to help them put the work on. Or there might be a group of activated citizens saying, we want to do a park cleanup, you know, can you sponsor a couple, whichever, to help us with this? And then we would have that voice to say, you know what, I know Suzanne has money, I could go to her and ask her, or I could go to the municipality and see what it is. So it's kind of collectively coming together to see what is it we need that would make this project even better, and approaching it that way.
Because the source of money usually has strings attached.
You're right.
You gotta have this requirement, or you gotta have that, you gotta have a number of things, or you must do a number of things in order to get that money.
Into that money. That's the unique part. So I mentioned at the beginning, the $50,000 that we get every year as a region. One of the lessons we've heard from community is that some of that funding need doesn't necessarily match what the community need is. So we are given more of a runway to figure out collectively as a table, where do we want to spend that money? So if I might get a proposal from somebody saying, look, we need money for, let's just say, to fix a playground. Well, I can't give you all of our $50,000, but I could give you maybe 5,000, and you could apply for a regional development grant and double your money, right? So that might be a little piece of the pie that I could do that, but the other piece I could offer, that string, you could say, is I have a whole team of people that are willing to help you fundraise. And so you're able to really double that investment, just on that small piece of the pie. So it is unique that it's not like you have to listen to those hour-long sessions on how to apply for this grant.
Orient might be a good example.
Yeah, that's a great point. So one of the projects this year was the Capital Regional Firefighters Association put together basically a strategy on communicating Voyant Alert across the region. And so what they wanted to do was have every municipality buy into Voyant Alert. But we know that Voyant Alert it's only good if people sign up for it. And so we said, look, we have $10,000. Why don't we earmark that? And we'll do a mini grant. And so municipalities can apply for those for funding, if they show us a way on how they can provide engagement in their community around Voyant. So, Sunbury York, they would be at the table. Jared Bishop is our emergency management coordinator. He shared with us that they're looking to draw a generator. And so by however many people sign up for Voyant Alert, that money from the grant was able to purchase the generator. And so it's a unique way to get that messaging out. And then it's a promotion with their citizens on how to get the word out about Voyant or register. So it's a little bit, there's some wiggle room. And I think that's the nice part about the funding, is that it's also the hard part about the funding, right? Because we all have to be in consensus that this is how we want to spend those funds. Any other questions?
And some of the projects don't require funding.
Absolutely, yeah. So maybe what I'll do is I'll jump over to, there's a slide here. For the 2024 project. Really, I'm not sure, it's a couple ahead there. Yeah. You'll see at the bottom, there's no number affiliated in the right-hand corner. So household access to food, transportation, housing, infrastructures that promote wellness. This happened last year when we came to the table and said, look, we really think it's important that we invest this other money into the other priorities, but we still think these 4 topics are very important for our committee to keep talking about. And so we have been a part of the New Brunswick School Food Coalition. We have some members at that table that sit there to help promote the provincial and federal school food policy. Transportation, we've been talking about accessible transportation. I know Gail's kind of been at that table in Nakawik from Wheels to Wellness point of view, urban rural rides as well. Housing, we started to see where some of these common threads were. So those housing champions that might not necessarily all be working together, but in their silos, how do we get them around the table working together and talking about housing? And the infrastructure is promoting wellness. This has kind of been looking at recreational infrastructure. And so how can we almost asset map where some of those parks and things are that don't cost, it's not professional sport, but it's still infrastructure in our communities that we could leverage for our citizens. Some of this stems from the many of our schools looking for playground upgrades. And so that's, again, that scenario I mentioned earlier. Can you help us with our playground? We might not be able to fully fund it, but we have a whole team of people willing to help you fundraise or find funding. So those were the 4 pieces that we felt important, along with the funded project work that the committee was working on this last year. And Kelly, if you go back to the previous slide, this is just a snippet of all of our partners that are sitting at this table. And so I recognize we have all of our municipalities, our 3 First Nations communities, a pile of nonprofit organizations, and then up in the corner too, you'll see One Team, One GNB. These are a number of provincial stakeholders as well that are in and around our table. So it's kind of a lot to break down, but each person or each logo kind of represents a gift that we're able to tap into at that table as well.
So where are they all located?
Like the nonprofits, you mean?
All those, that whole page up there? Where are they all located?
These are all representatives of organizations in the capital region. So there's some sort of representation from each of these folks at our resiliency table every month. And so I want to say last month, Lise, you were there, probably 25 people in attendance, plus I want to say 10 or so online. So we're starting to really climb. It's become a network hub. And so from that, after the meeting ends, I normally get, hey, can you send so-and-so's email? And it's almost like an informal speed dating that the event that Lisa hosted earlier. And so a lot of that benefit, that return on investment is really around those connections that happen at the table.
And they change from meeting to meeting. You have different people around the table. And so we have some people leaving, some people arriving. There were several new people last time.
There were.
Yeah.
And Director Rogers.
Yes, please.
Hi, so thanks for the presentation. I just have a few questions. So I might just, if the chair is okay, are you okay, Chair Hayward, if I just go through the questions? Okay, So first off, I just wanted to know, would you be interacting with the City of Fredericton's Office of Community Inclusion? I don't know if you and Gwen have connected.
Yes, Gwen's been coming. We actually have plans on Wednesday to connect even
Perfect.
further.
Okay,
Yeah,
perfect.
and I also work with folks in recreation as well, so Bobby and Jarrett.
Perfect. Okay, that was my first question, because I didn't know how this committee was interfacing with the work that we're doing at the city, a lot of similar work. So what about on the housing? You mentioned, I noticed on your list of things, and it was sort of like lots of groups doing lots of different type of work in housing. The City of Fredericton has an affordable housing committee. I chair that committee. We have not connected. And we certainly, our committee is a multi-sector group that does capture a lot of those groups. So
Yeah.
I would think that may be a connection that should be made. Another,
Great.
pardon me?
I was just gonna say, we've kind of started down the path of where do we all fit, and then the mayor's table for housing has come up. And so I think it's just to build on that, see how we could network or partner. I want to say it's Sandy McKinnon is our contact. Fiona Williams was starting to lead some of that conversation, but it came to the point of, you know what, let's not duplicate, let's see if there's opportunity for alignment, and we just haven't acted on it yet, so would love that opportunity.
Yeah, I also would suggest, I think it's great to have the connection. I don't know, my experience in this world is I'm not so sure housing is something that you'd want to take on, to be honest. It is very significant. And so I guess I asked if you interface, but yet I would actually say, I'm not so sure that it's, I think it's beyond what the capacity of this work. But that would just be my own personal recommendation. I'll let you come to that on your own. It's quite vast, and it has, and it's quite complex, and it could just drain your energies from doing anything else, but I'll just put that out there. The other question I have is, so I know GFSI, those of us who've worked in community have been fixated for a long, long time about how you bring people together and network in community and all of that. GFSI, we used to host, when I was at Fredericton Community Foundation, we hosted the executive directors of nonprofit organizations. GFSI now does that. Is that a group that you're tapping into, sort of those morning breakfast meetings?
Absolutely.
Okay.
Yeah, absolutely. And some of the other additional pieces, like it kind of feels like post-COVID, and this is talking about like our recovery piece to the emergency management, is that post-COVID, we've just gone off on our own in more silos, and now we're seeing more people come back to the table and say, hey, we used to do this. How do we reconnect? So I just had a conversation yesterday, even with Salvation Army, to talk about like, hey, we've started a breakfast club. And a lot of my work is just, do you know about the other breakfast clubs that are happening? Is there ways that I can help align? And so some of those conversations naturally happen just with the folks in and around the room. Like there's so much good work being done, but it's hard to learn and keep track of all the work that is happening. So a big part of that is just to be that convener, or traffic navigator, essentially, to point people in those directions.
So by doing this, so now I'll get to my final question. So by doing this, do you imagine alleviating, so all of the other groups who've taken on this work of trying to coordinate and create networks and, you know, all the good stuff that you're trying, trying to be accomplished and that you are accomplishing, does this now mean that the other groups don't need to do that stuff? Because I know a lot of community groups in the past have stepped in to do that. It's on, they do it because no one else is doing it. I think they would welcome having a convener. I'm just wondering if that can happen.
I think
an
informal role for sure as a convener, but as the conversation I had yesterday with Salvation Army, we all have our little niches and our circles. And so if it makes sense to keep doing what they're doing and they're still finding benefit coming to our table or merging tables, then absolutely. But we meet once a month. And one of my goals is to connect people and help to align those strategies. So if I'm understanding correctly, it would depend on the group that's willing to come, that we can help to provide that alignment or that space to convene, but also help to build capacity essentially as a region.
Thank you.
Yeah, for sure.
Carrie, May I ask if you ever have any challenges with trying to balance replication of work with so many entities and so many different bodies, all with the best of interests? Do you have any challenges in not replicating work or going in different directions with similar work?
Absolutely, and I think that's kind of part of the gig, to be honest. Like, as a good community developer, we don't want to be the doers, we want to convene the doers. And so there's that whole like collaborative of the turf and trust, right? When you're collaborating. And so there's many of our organizations that are just coexisting right now, right? They're not fully integrated or fully collaborating. So I think my role is helping them to move across that collaborative, build the trust that they need to be able to fully integrate. And we know, like, in many scenarios, they're all after the same resources, right? And that's what causes that knot or that tension, whether it be funding resources or human resources, what have you. So if there's a way that we can see in the picture that we're all working together, then that just helps to untie some of those knots and see that we can have that greater impact at the end of the day.
Thank you. Any other questions? Okay, can you carry on then, please?
So the only other thing that I just wanted to mention was a little bit around some of the priorities that we're talking about at this table so far. So I mentioned this would be the time of year we start looking towards upcoming years. And a lot of the key threads that we keep seeing is that social connectedness. So when it comes back to food security, housing, transportation, and if you pair that when a bad day comes or hurricanes here, this time last year we had a hurricane for Harvest Jazz and Blues. Oh yes, thank you. How do we build it so that at an individual level and a community level, we feel more prepared in time of disaster when that does hit? So some of the programming has been around inclusion. So one of the projects that Suzanne has helped to lead is called the Community Connections or Neighborhood Connections. So it's a small mini grant intended to just help people get to know their neighbors. So I'll use the scenario of I mentioned I met with Martina at Salvation Army yesterday, and she shared that her husband's grandmother had lives in a small little suburb. And she used to know all of her neighbors and could go to any of them for a cup of sugar if she wanted. They're all now from Ontario, most of them. And she's like, I don't know who they are. And so that whole connection, that way to get back in and get to know your neighbors has kind of been lost post that recovery, post that change in our population. So if you think of a disaster were to hit, or if someone were breaking and enter into the neighboring house, would that person feel comfortable taking action or being that engaged citizen? And so I really do feel that it starts there and adopting that neighborly mindset. So if we can start to work at some of those projects in the upcoming year to see what that looks like or what that return on investment could be later, I think it would touch on a lot of those different priorities that we're already working on. That's all I have, but I'm would love to hear some of the projects that are happening in your communities or anything that you're seeing. And I will plug that our next meeting is Monday, September 23rd. We'll be at York Care Center at their Friendship Center from 9 until 12, and there's a hybrid virtual option as well.
What was the location again?
It's at York Care Center, and it's in their Friendship Center, is what they call it. So we're being hosted by the Nursing Home Without Walls. So they're a new partner at our table, Candace and Robin. Some of the other new partners we've seen is UND's clinical psychologists. They're trying to look at upstream approaches to supporting mental health in the province. We've seen an interest in convening some of our NGOs that are in the emergency management field, so around emergency food access. Anything, I'm looking at Lisa and Suzanne because you're at those meetings. Anything else coming to mind for some of the projects?
Page and Carrie, if I mentioned.
So what would you call this group that's, I'm trying to place them there?
So we're called the Capital Region Resiliency Network. And so we would be a steering committee. We're in the yellow,
Okay,
the 12 steering committees. So I'm one of 12 committees in the province, or one of 12 coordinators in the province that chairs one of 12 committees.
okay, so, and did you have attendance from Nacogdoches Millville area or the Harvey Station area?
Definitely. Yeah. So Gail is our #1 girl in Nacogdoches. We have community developers in the area too. So Emily Shapiro, I know Cheryl Pepin attends on behalf of her role with with Horizon Community Development. Trying to think of some others. We've had some engagement from recreation leaders in Harvey. Some of the principals as well through our school food. So the Nacogdoches Feed the Hawks program.
Okay, those are, so this is mostly social types of issues that I'm hearing about today.
Exactly. So on the terms of reference slide, I could reference this here. On the back, you'll see like the high impact areas of resiliency. They're broken down into 4 categories. So our economic security, stable housing, built environment, health, social service, justice, education system, and environmental sustainability. And under that, there's 17 priority areas that we would focus our work around. So for example, household access to food would be it's a big one at our table right now. We know that food insecurity rates are rising. And that would be where our school food policy work would fall in as well. Internet access has been a topic, or communication. So that's where our Going to Learn communications come in. How do we reach the most vulnerable? So not everybody has a cell phone or internet access. How do we make sure that everybody's being communicated to? And you'll see too in the back, one of the projects this year was around basic income. And so that fell under our economic security employment high priority area. So strategies around how do we promote or advocate for basic income.
Are there any other questions for Carrie? On that note, thank you very much, Carrie. The next item on the agenda is the UNB Institute of Population Health. Dawn, did you wish to speak on that?
Yes, thank you, Mr. Chair. The community members may be interested to know that earlier this month, CEO Smith and I met with Dr. Jennifer Russell, who we will remember as the province's chief medical officer during the COVID experience. She has taken on a new position with the University of New Brunswick, leading their institution of population health. And it was a very interesting conversation. She will be speaking to our board, or the larger board, on our meeting on October 1st. And I wanted to take this opportunity to pass on a request from her in developing her conversation for the board. She's very interested in what the health implications are in your communities, and with reference to the health implications, the health determinants, the types of things that the Institute is going to focus on are, health inequities, fairness, and making sure that everyone has not only access to treatment, but preventative treatment and information to live a healthy life, policy development around the population's health as opposed to individuals' health, community engagement, and research in between different disciplines, as well as compiling health data and analytics to as a foundation for fact-based decision-making in the area of health. And so on her behalf, I don't want to sort of get the first thing that pops into your mind. I'll ask the members to reflect on, you know, what are the issues in your communities. I'll reach out to you and follow up with respect to that, and some things that we can sort of suggest to Dr. Russell that our larger board would be interested in hearing about. And John was at that meeting.
You had everything
Okay.
perfectly done. I think that there wasn't anything to add to that. She's still as dynamic as ever, and I think we should look forward to the opportunity to work with her and her team. And I think we can learn a lot from her. She has lived experiences, and she brings just a wealth of knowledge to the table. And I don't know if her band is playing this weekend with the Harvest Jazz and Blues, but she's also a talented artist. So.
You just
Very
touched on-
gifted.
You just touched on an area that is really come to my personal life in a big way.
Yeah.
And one that I come to think of myself as part of an age cohort that perhaps would be part of a throwaway society.
Right.
I've watched my sister-in-law spend about 10 or 11 months in a hospital waiting for a nursing home.
Mhm.
And her weight went from about 130 to 140 down to about 80.
Yeah.
The worst possible place you could place a person.
Yeah.
And every little community in our region could tell you stories like this. My other sister-in-law is in the hospital in Miramichi right now, waiting for a place in a nursing home. And it's just terrible.
Yeah.
And so we say that's too big of an issue for us to take on, because the primary responsibility, I think, is down the hill. And for years, they have failed to address this need, because it became very obvious 25, 30 years ago what it was going to be like today.
Yes.
We've got an increased population, same hospitals, in fact, fewer hospitals, because they've closed the small ones. And I think it's not only has a extremely negative result on those people who are waiting for nursing home care, but it also impacts their families. And so in my case, my wife is the third of 4 girls, and the first 2 are in the nursing home or waiting. And so she's afraid she's
Right.
next. So, but anyway, I'm thinking, that's too big an issue for an organization like this. It takes a political decisions at a higher level. But it sure reflects on community development.
Right. Well, one of the areas that the Institute is interested in is policy development. And analytics and wants to hear, and I think you're right. I don't know, it will take everyone, I think, to influence policy change, and this will be one voice. We should help feed it, I think.
I don't know if an organization like this could have a position on it that could influence policy. I think that's what you're
Yes.
addressing, but I think whatever direction, whatever feedback governments can get in this respect couldn't help but be useful to some degree.
That kind of broaches the larger area that we've been tasked with, what we refer to as the social file, which is mental health, homelessness, and poverty. And I know that our board, and I suspect this committee is, interested in what role we're going to be playing there. And there's, it's an evolving situation, and I know John is in contact with community development, ELG on that, and you might want to just bring the members up to date, John, is sort of where we are on that line right now.
Thank you very much, and through you, Mr. Chair, to the members. I met with social development in late August, And I met with their assistant deputy minister and their director of implementation that also had previously worked. We often hear about the work that's happening in the Southeast Regional Service Commission, and especially around housing and homelessness. And so I met with them and I had a good chat. And really what they're looking at from us in this stretch leading to, you know, from now to probably Christmas, early Q1 in the following year. Really, they're looking for us to set something up, a group that could guide. We were thinking about possibly a CEO table, a CEO working group, and we mentioned that at our last meeting, had some discussion. Subsequently, the COO and I met with Suzanne and Director Fox off site to talk about that because of their extensive knowledge in these areas. And really what they want is, how do we put what we have to wrap our minds around is how, to your point, Member Simpson there, Director Simpson, how do we bring all this together and what do we want to do? And at the same time, how do we not impede the good work that's happening today? So how do you take that? We know that the city, our capital city is doing great work in several areas. How do we ensure we don't duplicate that? Again, to your previous point, but how do we get the data that we bring the region collectively together and in terms of that? And some of the things that we were talking about, we met also prior to meeting with Dr. Russell. We also met with Dr. Comstock, who's also working on physician and healthcare recruitment in the region with Dr. McClellan. And one of the things that she flagged for us that would be paramount, and it also came out in Ignite's work in terms of attracting people to the region, is a healthcare asset inventory. And they were saying that would be extremely helpful to understand all of the assets everywhere in the region, not just in certain pockets that they know of. So we're working with Ignite on that, and we're going to undertake that work on the healthcare asset inventory. And what that will do is help us to lead to these further pieces on health needs assessments, looking at the social determinants to health, which you were talking about, Director Simpson, in terms of that, bringing all of that, trying to bring that together. So we're looking at forming, I'm looking at forming a CEO working group made up of CAOs and possibly some other members or other key people from different areas that understand that work intrinsically and develop that data source. And they've reached out after this subsequently and sent me many contacts and links where we don't have to search far and hard for a lot of this data. Really what we got to do is bring it together and look at it and say, okay, what does this mean for our region? How do we get the right people around the table, and how do we put a proposal together? Because what Southeast had done, they were responding to their homelessness crisis at the time. And what they did was they worked with social development, they put their staff in place, they brought together the information, the data, they understood it not just from a central perspective, but from a regional perspective in their region. They worked with multiple levels of government, and they brought forward a recommendation. And those recommendations were instituted because they worked together, and they now have action items. They now have actionable pieces that they're doing, and we will be getting in touch. I've already been in touch with the CEO there. We talk regularly. We're actually meeting next week, and we'll be talking about what are those action items? What do they look like? What came out of that? And then we can learn from that experience and apply that to what are those needs in our region. And like they said, we don't have to duplicate heavy on the data. It's out there. We just got to bring it together. Such as Carrie was saying earlier in her presentation, one of the things that they're looking at in a social determinant of health is youth activity. And we have an asset map that we've done more than a year ago now for the infrastructure committee. And we're working with that, and we're updating it. So we can share that and we can make that work. And we're looking at trying to put that up on our website. And we're just updating because some of the communities hadn't had as robust a report as we would have liked at the time. I'll just say that. So we're updating that work now, and we'll have that, and we'll be able to utilize that. And where that also comes into play is with physician and healthcare recruitment, because when doctors and healthcare professionals are looking at the region, they want to know, what do you have? I was at a reception last fall with Director Rogers and the local residents. Some of them, their interests weren't in, it wasn't all about the hospitals. It was about their work-life balance. What are the music festivals? What are the trails? What are the pieces, the asset inventory that you have? What are those things that the community has to offer from a holistic approach, not just a singular lane approach? So we're working on bringing all these pieces together, and we're really trying hard to do that. I think Director Rogers may need to chime in here. Oh,
You're on mute.
thank you.
Mayor Rogers, you're on mute.
Sorry, no, I have no need to chime in. I have to go though. Someone just came into my office and I have to leave. I'll chime in and then I'll say so long to everyone. I think it's good that we're going to be looking at this, just given that our region, the most recent data indicates that we are the poorest served in healthcare for primary care in the province. Fredericton is, and of the region, the city is the worst. So this work is really, really important. Anything we can do to help advance getting more primary care for our residents in the region is critical. So if we think this will help with that, I'm all in.
Thank you, Director Rogers.
I'm sorry that I have to sign off now, but thanks. This is a great meeting. So thanks, everyone.
Enjoy your day.
Yes, you too. Bye-bye.
Dawn, did you have anything further to add at this time?
No, other than, it's always nice to preview the coming attractions. And so the members may be interested to know that next month we plan to have a presentation on 211, which is, I think, an underutilized and poorly understood service that's available to people that is in our wheelhouse. And we will then begin the development of our own community development strategic plan. There's a requirement under the broader plan for the commission for us in years 1 to 3 to develop our plan. And so it'll be timely to do that. We've had an opportunity to hear from a lot of people. We've had an opportunity to put our foot in the water, and we'll from our initiatives that we take on in the next year, that'll help inform it. So stay tuned. I think it'll be an interesting October meeting.
Thank you, Don. On that note, thank you very much for your presentation, Carrie, and thank you very much for your feedback, Don and John, as well. Are there any other questions for the presenters? On that note, I'll ask for a motion to adjourn.
I move to adjourn.
Seconder,
I will. Move, I will
Thank you.
second that motion. I will know.
meeting adjourned. Thank you very much for your time, everyone. Have a good day.
Thank you.
Thank you.
Thank you.